Hi, guys. Welcome to Redoctoring. This is the podcast that allows you to be a different kind of doctor. I'm your host, Dr. Diane, and today we have a very special guest with us. Aisha, please, would you introduce yourself and, yes, tell us where you are in your career right now?
You so much for having me and inviting me onto your podcast. It's a really inspirational setting that you're creating for other doctors. So I'm really happy to be here. My name is Aisha. I'm trained as a doctor. I went to UCT. And shortly afterwards, I realized clinical medicine wasn't for me. So I transitioned out of that. I moved into research and particularly health economics. Worked in different spaces, both private and academic. And now I'm based in the UK and I'm doing my PhD.
That's incredible. I think let's start with your story from before you went into med school. Is
Sure.
becoming a doctor something you always wanted to do? Did you have other options?
Yeah, I mean, the simple answer is no. Um, I had many options. I wanted to be a pilot, actually.
Wow.
Which in hindsight wouldn't have solved any of my issues that I had with medicine. The lifestyle is fairly similar. But
Mm,
yeah, I think when I was that young, I didn't quite understand what I was choosing. So to say that I had other options is true, but only on paper. I don't think I knew exactly what I was looking at the time. Um, but yeah, for my parents, I think stability was really important. And so they would have preferred for me to go to university and do a professional degree. And so I pretty much chose medicine through a process of exclusion
mm,
rather than choosing it because of a passion that I had. It was just something that was familiar to me. There were so many people in my family that were doctors, so it just seemed like the obvious choice, I guess. I ended up there. I wouldn't
yeah.
say I walked into it. I more like stumbled into medicine.
No, I hear that. I hear that. I think what's very confusing about society now is how at 18, everyone
Mhm.
wants you to make such a permanent life decision when you have no life experience.
Yeah,
So it's
yeah,
quite crazy.
yeah. It's
Mm.
you also haven't even begun to touch the true essence of who you are at that
Mm,
age. You're still coming into yourself. You're still learning about the things that are important to you. And so it feels like a really impossible decision to make when you're that
mm.
young. Yeah.
Yeah, no, most definitely. I think there's also the expectation, if you have good marks in school, to also go down the medical route or like accounting or something. Um, so it's something that we need to navigate better one day when we're parents.
For sure, for sure. I think uh, there's a disconnect between um, believing that someone should do something because they are good at it and someone should do something because they enjoy it. And I think when you
Mm,
perform in school, uh, there's a tendency to lean towards assuming that you enjoy everything that you are perceived to be good at, um, rather than following your
mm,
passions, which is a safe option, and I take that. Um,
mm.
Sometimes that is enough for people, and that's something that's a personal choice, I suppose.
Yeah, no, I definitely do hear it. I definitely do hear it as well. Now, coming into medical school, which varsity did you study at?
UCT.
Okay. How was that? Were you close to home? How was the whole experience of med school?
Yeah, I mean, the choice was made because I am Cape Townian, as you can probably hear, and yeah, I got to stay at home for medicine, which has its pros and cons. It was fairly grueling to go from high school into medicine in particular. I think that transition is hard for anyone. Um,
Definitely.
yeah, the the experience of my undergrad was mixed. Uh, I struggled quite a bit early on to identify as a doctor, and I continued to feel that way um, throughout my studies. Um, it just felt very removed from my personality and my identity. Um, and so that was a really difficult experience. And obviously, most doctors know like med school is not a walk in the park. It's very demanding.
Mm.
It's very taxing on not just your body, but also your mind. Um, but in the process, I enjoyed the expansiveness of the experience. And I made so many wonderful friends. I met my husband in mid school. So, yeah,
Oh,
so many positive things came from a very difficult time.
yeah. No, definitely, definitely. I think even when I reflect back to medical school, I'm most grateful for the people.
Yeah,
Definitely the people that came along with it.
yeah, you
Um,
almost trauma bond.
yes. It's trauma bond, but also people are such gifts. People are truly gifts. And even though you go through a hard situation, just to know that you found these gemstones of people, it feels like, there was some parts of the journey or that process that was good. That was good.
Yeah, yeah.
Mm.
And it's an experience that so many other people don't get to have. And so can't relate, and having those people in your life that understand exactly what you're talking about and those like intangible experiences of being in med school or being a doctor um, is so validating. Um, yeah, I really value those relationships.
No, most definitely. Most definitely. And when you were speaking, you said that you felt like the medicine journey and your personality, they they weren't going together. Was it more of the clinical work? Was it the workload, the pressure? Are you able to pinpoint which parts of medical school made you feel very uneasy?
It's hard to say that it was one specific thing. Um, I think that as I was coming into myself and realizing what was important to me, it felt as though medicine was an opportunity cost to the way I wanted to live my life and spend my time. Um, I am not someone who um, sort of gets consumed by my work. My work is just a part of who I am. And while I was in medicine, I felt as though I was losing myself entirely and my identity, and I was struggling to hold on to who I was outside of medicine. I noticed that when I was with other people, they would only be doctors because I didn't have time to sort of meet new people outside of that space. When we were
Mm,
together on the rare occasion that we could socialize and our sort of schedules aligned, we were always talking about our jobs, sharing
yo.
anecdotes, talking
Mm,
about like our experiences in the hospitals. Um, and there was really just not much else that I could bring because there was just not much else going on in my life. Um, and I really struggled with that aspect of it, as well as the fact that I am someone who values curiosity and learning. And that's something that's core to my life. Um, and although people think that medicine is some sort of like gifted program, and some people are going to be mad at me for saying what I'm about to say, um, I
it's
felt
okay.
as though I was very unstimulated. The rote
Mm,
learning felt very mundane. Um, and I felt like I was dumber at the end of mid school than I was at the end of high school. And I had a longing for returning to the part of me that got excited to learn something new um, and broaden the way I think uh, outside of sort of pattern recognition, if you will.
No, no, I definitely hear you. And I totally relate, especially to the part where you mentioned how when doctors come together, it's a lot of
Mm,
medicine that is discussed.
mm,
And unfortunately, you even find those doctors who make their profession their whole entire personality.
yeah,
And I think it just speaks to how there's no boundaries. Well, there's very
yeah.
small boundaries that people create with the profession. Were you able to navigate that as you were able to progress in the years? Did you navigate that better even when you started working, or was it still something that was such a big stumbling block?
Mm, I did my best to sort of add new things to my life, especially after I had finished med school. Um, I wanted to learn new things, try new things, like get a hobby, which
Mm,
seems so simple, but there was just no time and space in my life at that point for anything else. So I did make an effort, but I would be lying if I said that it didn't remain an issue. And I think for a lot of people who feel this like consumption of their identity, it's not really about who they are, but more the circumstances that are created in this sort of environment where you're really working the majority of your life um,
mm.
in a context that is not simple or easy and quite frankly often traumatic. So um, yeah, it's a difficult thing to walk away from.
With your support system, were they supportive of your feelings during the whole medical school process, or what support did they offer you? How did they come across this with you?
Yeah, I I knew that I wanted to leave in second year, so I was really young at
Wow.
that point. Um,
Mm,
and when I reached out to my convener saying that this was how I felt, he told me that things would get better when I reached my clinical years, and he's seen people like me, and everything will work out. And I sort of trusted that as someone who was so young, looking up to this person who
mm.
had done this for like 40 years. And then clinical years came around and things did not change. Um, but at that point, I fell into the trap, and so did my family and friends, I suppose, of um, like reaching for one next thing. So it was always just finish your
Mm.
preclinical years, just finish medicine now, you're already in. And this like sunk cost fallacy came into play. Um, and I think that that's prevalent throughout medicine. There's always one next thing. Um,
Yes.
it's internship, then it's ComServe, then it's MO, then it's reg time, and you can continue ad infinitum um, because you can't let go of the time you've spent getting there.
It feels like you see when someone's in a very long relationship and
Mm,
they spent like 5 years, then they say they don't want to leave because of the 5 years they've invested. I think there's a deeper sense of that when it comes to medical school.
yeah,
Um, that can sometimes turn quite toxic. It can. I think
yeah.
I love your story and I quite relate to your journey as well because in second year, I think there's just something that happens. The workload increases,
Mm,
you get the real reality of university. And I also started feeling like I wanted to do something different with my degree. And it was in second year, because you like some aspects of it, but then there's other aspects that you want to transform.
mm,
And because barely anyone speaks about these feelings and you assume everyone is fine, it's hard to bring those feelings across.
for sure,
Mm,
for sure. It feels, or rather, it felt um, like something quite shameful, like I had
yes.
failed. Um,
Mm,
or like I was letting myself and everyone around me down somehow for wanting something different. Um, but I will say that when the time came for me to walk away, um, I received the support that I needed from those who were close to me because I think they had seen the progression of my sort of difficulties and understood how absolutely necessary it was at that point in time for me to choose myself.
No, definitely. And at some point you have to, because life is always going to have a lot more next ones, and that's all you hear through med school. No, preclinical was bad, clinical will be better. No, internship will be
Mm.
better. No, ComServe will be better. And at some point you have to go with what's right inside and not what was right for another person's experience. So I commend you on that. I really do. I can only imagine how hard it must have been. Were you doing I think you were doing your internship at the time when you formally exited.
Yeah, that's right. Um,
Mm,
I'm really grateful that I got to that point where I gave myself the opportunity, and that was very conscious, to do sort of the real working world, and not just leave after studying. So that there's no part of me now that questions whether I should have stayed or not. I have absolute clarity on what I left behind. Um, but yeah, I wouldn't say that I chose to leave. I think it chose me. Like, you just get to this
mm,
point where you can't anymore. Like, um, yeah, you're sitting at an intersection, like a fork in the road, where you have to choose
mm.
to yourself or everyone else, and that's not a choice I was willing to make. So yeah.
Exactly, because at the end of the day, we're all going to die one day.
Mhm.
And you don't want to have the regret of you wasted your life or something like that. That's quite hard.
You Medicine is a tricky one because this deep sense of security. I mean, not so much anymore with people being unemployed, as you mentioned. Um, but there's almost a clear pipeline, um, and it takes off that pressure of needing to figure out the direction that you want to go into versus leaving and needing to map that process out for yourself, which is incredibly daunting, and the cost that you pay to leave. So for a lot of people, a trade-off is not worth it.
I hear that. I hear that. You mentioned clarity
Mm.
previously, that you had clarity with your decision. I think it's something that's lacking a lot amongst our colleagues. How would you go about or advise someone with regards to finding clarity in this career?
Um, I think the first thing that I would say is to honor your feelings, whatever they are. Um, that's very difficult in that space. It's
Mm,
also, I talk about clarity, but that doesn't mean that my mind was in fact clear. Um,
mm,
because, like I say, when you're so consumed and you lack identity and you're overworked and burnt out and fatigued, um, none of that lends itself to any sort of a clear thought. Um,
mm,
Couple that with the fact that options are not well known, they're not accessible outside of clinical practice,
mm,
and the fact that you won't receive support from other doctors. And that was my reality. I'm hoping that that has changed. Um, all of those things will not allow you to validate your own experience, um, and honor what that is for you, because that clarity looks different for everybody. And you really have to tune in and listen so carefully to your intuition, um,
mm,
and let that guide you to the next step, even if that step is not apparent to you in the moment. When I left, I had no idea what I wanted to do. I had no clue what my path was going to be. All I knew is that I needed to leave, and that
sure.
was enough. Um, if you listen enough to yourself, you know what the right thing is to do for you.
When you stepped away, did you plan? Did you have a plan? You said you didn't really know what you were going to do. Did you take a small break? Did you move back home? How was the experience?
Yeah, I was very privileged around my circumstances at the time. Was already married, um,
Oh,
and my
wow.
husband was working. So um,
Mm.
I had the luxury of having the space to walk away from my work and my salary at the time, and take a break. I took about 2 or 3 months off, um, and I really just spent that time trying to return to myself and who I was to be able to answer the question of what I wanted to do next. Um,
Mm.
that was difficult for me to do in such a short space of time. And so the only thing that I could latch onto was the fact that I remember liking maths and like quantitative work. I didn't know if that was still true because I hadn't done any of that for the last, I don't know, 6, 7 years before that. Um, but I thought it was worth a try. So I just started looking into what options there were for me. I took short courses online and I just followed my gut on what felt right to me, what I enjoyed the most, what brought me joy. Um, and I leaned into that. Um, and that's really how my path formed. Um, no clear outcomes, no clear direction, just following what felt right.
I saw a quote that actually said that you can't connect the dots looking forward, but you can connect them looking back. So sometimes in
100%.
retrospect, you're able to see the journey that you actually took and how it led you to where you are right now.
Yeah, for sure. Hindsight is
Mm,
2020.
there we go, definitely. On your website, you are at the intersection of a lot of different spheres, I would say. Some that I have personally only encountered this year. Like I did not know, for example, doctors can be in machine learning. And health economics is something I recently found out about. So just to give description as to what you are currently doing, can you please take us through the health economics portion? Like, what is health economics?
Yeah. Health economics is many things. And there are different sort of groups of health economists. I broadly put them into economic evaluation and econometrics. That's not to say people don't cross over. Um, I think a third sort of category, which people would probably be familiar with, is something around healthcare financing. So if you think about like the national health insurance, for example, that sort of decision making and understanding of the economic mechanisms around that is what health economists can do. The
Mm.
econometrics part is economics meets statistics, if you will, traditional statistics, and merging those two. And then economic evaluation would be considering the fact that we have a very limited budget, healthcare budget. How do we make decisions about what to fund, um, and how do we choose those in a cost-effective way? So that's
Oh, wow.
broadly the health economic space. Um, yeah, so lots,
Wow.
lots within that.
It sounds like it's a lot because I only understood the health financing part. I imagined that health economics, they run the hospitals, they are the people that, do all the numbers in order for the medicine part to exist.
Yeah, broadly speaking, I think economics is a
Okay.
nice uh, balance of quantitative and scientific rigor and sort of pragmatism of the system that we work in, which is quite enjoyable.
I know you can do masters for health economics. Would you
Yeah.
advise someone to do the masters to get into it, or can you do a whole bunch of short courses to go into it?
Um, well, my first step would be definitely do some short courses online in economics itself. I would start there, just do basic economics and see if this is something that you enjoy, because there's a way of thinking that's associated with economics. I personally obviously am biased and think it's quite fun. Um, but I would just evaluate that as a starting point. Um,
Mm.
and then with regards to health economics specifically, I wouldn't say that you have to do pure health economics in order to work in the space, because it is a very uh, multidisciplinary space that you work in. And so people around like policymakers, clinicians, everybody weighs in on that process. And
Oh,
so you can
wow.
enter the space from many different doors. But I would say that if you want to do the more, scientific, quantitative modeling, theoretical type of work, then the master's is definitely the way to go.
Wow. No, that's quite interesting. It is. Um, with regards to doing masters, I know there's some universities in South Africa that have them. But I was talking to a friend of mine, and he says that, whenever you are adding onto your CV, it's not that it's better, but you can also look abroad to see what other countries have, because then you have the other country, like something from a first world country, backing what you already have from South Africa. And a nice way of doing that is with scholarships. Have you had any experience with scholarships?
Yeah, I mean, um, I'm currently on a scholarship. I think uh, it's very difficult to study overseas because international fees are substantially higher than local rates. And so for most people, you have to have a scholarship in order to do a postgraduate degree overseas. But it's definitely useful um, when you want to niche down and really go to the places that are the top of the field that you want to be in. I don't personally think that
Mm.
it's necessary to do that from a health economics perspective. Um, I know the program at WITS and UCT are excellent. Um, the teaching is phenomenal. Again, biased because I taught at WITS, but like I don't think that you are limited in any way by doing that master's in contrast to a master's overseas. Yeah,
No, definitely. I think go for what you can afford, firstly.
yeah. I wouldn't put yourself in
Yeah,
debt. It's not necessary. But
exactly. It's
also
it's
reach
definitely
for the
not.
stars. Like there are so many scholarships. And why not? Like, like
Mm.
shoot your shot. There's nothing to lose. Um, that's what I would say. Yeah.
I also looked into that. I took a break beginning of this year just to recover from ComServe and everything. And that's when the whole scholarship
Mm,
knowledge, well, I was acquiring a lot of scholarship knowledge, and I looked into that. I think if you look at it as an adventure, like if you just look at
yes,
it as an adventure, studying abroad, seeing what could happen, it can actually work out.
100%. And that's true for
Mm.
everything. Like this entire experience is not mapped out for you, but at the same time, that means you have more potential to go in so many different directions, ones that you don't even know exist. Um, so just remaining open to any opportunity or possibility is something that will really open so many doors for you. Follow your curiosity and you'll find your place.
Exactly. Like, I think you have mapped out, not mapped out because you're not yet done, but you have quite an interesting career. Another facet of your job is public health. Public health, I think, is the most popular non-clinical thing that you doctors can do. Um, yeah, what is public health in case somebody is coming across these two words for the first time?
Um, public health is everything. Uh, yeah. everything is public health. It's
Mm.
really, really broad. Um, Health economics falls under public health in the way that I use it. Um, I would say that public health is broadly about policy and decision making around population based healthcare. Um, and so that can span any part of life, which is why I say it's everything. Housing is healthcare. Your job is healthcare. Your streets are healthcare. Pollution is healthcare. Global warming is healthcare. Everything relates to population health in some way, shape, or form. And so everything is public health.
No, that's a beautiful explanation. It actually makes doctors and it can make us feel like we actually belong in a lot more spaces than just the
Yeah.
hospital because your health affects every aspect of your life eventually.
Yeah. And vice versa. Every aspect of your life affects your health.
And then another aspect is machine learning. How did you get into that?
Um, I followed my interests. That's the simple
Mm.
answer. Um, I enjoy learning. I enjoy new spaces. And the multidisciplinary or interdisciplinary aspect of healthcare is intriguing to me. I think that that is the future of medicine because, like I say, everything interacts um, to influence someone's health. Um, and so having the ability to sit across so many fields is where I think value comes in and innovation. Um, like problems can't be fixed in silos. And that's just my
Mm.
personal philosophy. So yeah, with the boom in like AI and machine learning, there's definitely going to be and there already has been an impact on healthcare. Um, and I was really curious about that space and how it can be leveraged. I know it's a bit controversial, but how we can make it useful for the work that we do.
No, definitely. I think as controversial as AI and everything is, I have always looked at it from the perspective of if it's going to help us get from point A to point B in a much more smoother journey, then we should at least be able to look into it and maybe leverage the good parts.
Yeah. And just simply
Mm.
understanding it as well. Um, I before rejecting the premise, I wanted to know what it truly was about, um, and I needed to understand that fully to make an informed sort of judgment.
I know
Mm.
some people, they believe that to form a career, you have to go for what's most in demand. And like you have shared, you believe you need to follow your passions. Do you believe that you are able to sometimes come to an intersection of both of those two things?
Yeah, definitely. Um, at the end of the day, uh, you need to find joy in what you do, but we also need to live. And I don't think that those two things need to be separate entities necessarily. Um,
Mm.
the dynamicness of the world that we currently live in and the receptiveness for novelty um, really lends itself to people who step out of the box. Um, and so I don't think that those two things are sort of opportunity costs to one another. I think that they work hand in hand, and you can create spaces that are new, that leverage new things, um, that are popular. Put your different spin on it, bring your perspective, and you'll add value. As long as you can add value, um, doing what you love, you can make it work.
Mm. Yeah, I think if we all look at how we can add value into the world and how we can help make the world a better place in our own unique way, I think it will guide
Mhm.
a lot of people with regards to how to make even career choices.
For sure. Yeah. Um, and there are unfortunately many problems in the world that I'm sure, like, we can all
Mm.
relate to. But that also means that there are so many possibilities to resolve those problems. Like, pick your poison, uh, choose the thing that you're passionate about, and then just move towards it with good intention, and you'll definitely make an impact.
With regards to your PhD, how is that going? I know a PhD is so hectic, but how's the journey going?
Yeah, so I think that medicine um, was really good in the sense that it awarded me with the capacity to work um, and and contain a lot of mental information, which has been really useful in my master's and now again in my PhD. Um, just being trained to take on quite a lot. So yeah, my PhD is moving forward. I'm
Mm.
halfway through now. I love learning new things, so it's really enjoyable for me. Uh, and yeah, I have the luxury of um, flexibility in my PhD. I have the luxury of following my interests in any direction that I choose. I get to meet new people in different spaces. I get to travel. It's really just been a real blessing in my life, like a really, really wonderful experience. I know that PhDs have a bad reputation,
Mm.
but it's really not been that way at all. It's a really enjoyable time, and I know that this I'll look back on this time with so much fondness as I go on in my life. So yeah,
No, definitely. It's an adventure at the end of the day. It's an adventure.
exactly.
Mm.
Yeah.
Your PhD, is it also in health economics?
Yes, primarily. I'm looking at both health economics and machine learning, and then bringing in the clinical aspect of personalized medicine. So, like, yeah, those three broad fields.
Wow. No, no, no. The intersectionality of it is quite interesting. Quite interesting. You mentioned that medical school gave you the superpower of absorbing the written word that you are consuming. Have you noticed any other aspects or any other soft skills from either your short stay in clinical medicine or medical school that you have also like progressed with?
Mm. I mean, medicine is so vast um, in its integration into your being and your life. And I spoke about the negative parts of that and how it consumed me, but simultaneously gave me so many things that I use now still. My medical knowledge, my ability to understand pathophysiology, that sort of thing, always valuable. And no matter where I go, no matter what level I'm at, no matter what field I exist in, um, because not only do I have an understanding of the work that I'm doing and the outcome that I'm trying to achieve on the ground, but you also achieve the ability to translate information to clinicians and explain to them the policy or the technical work in a way that makes sense to them. And that has been incredibly valuable from a policy perspective. So just like the knowledge itself is never a waste. I still use that. And then obviously so many soft skills, your ability to learn, your ability to remember, your ability to pattern recognize and integrate lots of information simultaneously. Um, and then the people skills are so valuable. Um, you might not be speaking to a patient, but everyone in front of you is a real human being at the end of the day with a whole life. Um, that you can fully absorb
Mm.
and grasp and sit in. Um, and that's a skill that will never let you down. Um, so yeah, lots of useful skills came from it, and um, yeah,
No, I love that. I love that. I think we need to also start looking at professions and also studying, not only as just acquiring the degree, but also all the soft skills that we gain with that. I spoke to a
yeah,
friend recently about leadership, for example, in healthcare, and how we actually don't get trained to be leaders. And then we are thrown into resuscitations, and they say, "You are the
hmm,
leader." But what does that even mean?
yeah, yeah. That's true.
Mm,
Um, I think there are also, uh, yeah, definitely there are definitely gaps in what the expectations are versus what you're trained in or what you're naturally skilled at. I think there's value in personal skills that are not necessarily uh, highlighted. Everybody doesn't have to be a leader, but the system sort of
mm.
forces that on you. Um, whereas if you step into your own abilities, uh, everyone around you also thrives. So yeah, I think it's a self-led process somewhat.
Definitely. And that's how you bring value into the world.
Yeah, exactly.
Some advice for early career doctors who are interested or even curious about what else lies out there with this degree. How would you tell them to or advise them to tackle these feelings or to even just start to stimulate their mind with other
Mhm.
journeys, other paths?
Yeah, I mean, I fully recognize that trying to step out while you are still doing medicine is not easy. So I'm not going to sit here and say, go read these books and do these courses and et cetera, et cetera, because when you come home from like your shift or your call, that's the last thing you have capacity to do. So yeah,
Mm,
like I say, I think there's so much importance in validating and sitting in your feelings. Become comfortable with discomfort. Um, Often we want to run away from anything that feels remotely unfamiliar or um, not mapped out for us. And I would encourage everyone to instead of running away from it, rather explore that non-judgmentally within yourself. Um, Try and block out the noise of everybody else's opinion so that you can listen to what you need to do for yourself. Um, and then there's so much out there with regards to practically finding a space that you want to go into. Um, I would say that you should not fall back on the old version of yourself. So a lot of people will approach me and say, I want to leave medicine and instead I want to do something else, say engineering. And you're like, why? And they're like, that was my second choice. Um,
wow.
and yeah, I think there's a trap there. We spoke about how making a decision as a child is not a wise decision. And so going back to your childhood decision is probably not wise, but there is some value in sort of remembering who you were and what you loved and enjoyed. Um, and then looking into how that sort of fits into the world right now. Um, Anything can intersect with medicine. People often feel like they're going to sort of get rid of their degree or lose the years that they spent becoming a doctor, and that's just never going to be true. Um, so yeah, I think it's so easy to find spaces that intersect. You just have to look, test things out, um, be okay with failing, be okay with learning something new and realizing you actually hate it, um, and then going on to the next thing. Uh,
Mm.
just trial and error, experiment, like follow your gut. Yeah, everything will fall into place if you don't stand in your own way.
That actually even reminds me of one of the reasons why I started this podcast, because I believe that when we encounter and we hear other people's stories, we are able to expand what we are able to envision for ourselves. So I think also another big thing that someone can easily do is go onto LinkedIn, and look for all the people that have the funky bios, because people are dentists and marketers and all of these five different things. And if you actually message them, they'll tell you a lot and it can help you.
For sure. Um, Most people out there are willing to talk to you, willing to chat, um, reach out. Again, there's nothing to lose. Um, yeah, it's a scary thing to do, and I recognize that. So it sounds so simple to just like cold message a random stranger on the internet. Um, but yeah, it's tough. Yeah.
Hmm. How has your experience been with networking?
Um, I would say networking is one of the most important aspects of my personal journey. Um, a lot of doors have opened for me because other people have let me into the room. Um, and people underestimate how much relationships come into play and how important they actually are. Um, because unlike medicine, where academic success is sort of the highest form of uh, quality assurance, that's not true in many other spaces. Being a rounded person is far more important. Um, and so networking becomes not just nice, but essential. Um, and there is a pressure to build that network. Um, but at the same time, as you move into spaces, that's how you get to know people rather than forcing relationships to exist. Um,
Mhm.
and balancing those relationship dynamics. Uh, when you create something of value in a space, you will automatically meet people who think in the same way that you do. Um, and if you bring people along with you, others will take you along with them. Um, and it's kind of like a karmic cycle to me of paying it forward.
You spoke about forcing, like when you're forcing relationships and forcing these connections to exist. I think that's what keeps a lot of people stuck with networking. It feels like you have to force it, and it's not something that can be fluid and just move with the motions.
Mm, yeah, I think finding your authenticity is what will prevent those feelings of stuckness. Um, because as an individual, as cheesy as it sounds, quite literally every single one of us has something different to offer. Um, no one's life experience is exactly the same. Um, and when you bring that version of yourself into a space, you will just naturally um, find the people who resonate with you, um, and foster relationships that are meaningful because they're not based on a version of you that you think you should be.
Wow. No, that's very deep. That's quite deep. Um, with regards to, a lot of people think that if you're an extrovert versus an introvert, you have to network differently. I
Mm.
know some introverts will feel like they have to stay online. Extroverts, maybe they go to all the symposiums and everything. Do you feel like both of them can actually work in either space.
Definitely. For sure. I think there's value in sort of the online space. Um, it's opened doors for people to meet um, people that would have never otherwise had access to. Being able
Mm.
to hop onto a virtual meeting like we are now across the world from each other is
Yeah.
brilliant. It's wonderful. Um, Being able to like just message someone on LinkedIn or email them, it's amazing. Um, but I think that there is also value in in-person interaction because you are more able to engage with the realness of the person um, and the sort of intangible aspects of one-on-one engagement that you don't always get online. That's not to say that it doesn't exist online, but I do think that there's value in doing both. And I know that the introverts will struggle with the in-person meetings, and they are difficult,
Mm.
regardless of whether you're an introvert or an extrovert. But I would say take the pressure off, come as your real self, um, and see where things go. Be fluid in the way you engage. You never know who you are going to meet in the weirdest places. Um, and yeah, I think networking is important, but also fluid. So it's daunting, but we all scared. It's okay.
Mm. And the worst thing that someone can say is no. I think sometimes
Exactly.
we overhype networking because we think that when someone rejects or doesn't want to necessarily connect with us, it's going to kill us. And it's not.
Yeah,
It's
rejection is
really not.
okay.
It's not the end of the world. And you just learn to bounce
Exactly.
back quicker with regards to the next
Yeah,
people.
for sure, for sure.
Aisha, thank you so much for joining me. Thank you so much for this conversation. I definitely feel like when we are able to speak about our own individual journeys, we are able to help other people. Because what you and I have experienced in our own respective journeys is a lot of quiet questions that nobody necessarily wore on their faces. And it can
Mm.
sometimes make people feel isolated or rejected, even in a certain field of life, even.
Yeah.
So thank you so much. You are on LinkedIn if the people want to connect with you. Are you on any other platform? How can the people find you
Um,
to learn more about you?
yeah. I'm on all the social media platforms. It's just my name, X surname. And my website is aishamula.com. I post blogs and information there for doctors who are looking to leave medicine um, and want to have those conversations.
Oh, definitely. Which are very necessary conversations. And I hope,
Yeah.
I really, really hope that someone reaches out and connects with you as well.
My doors are always open.
No, I can testify to the fact that I cold messaged you and you were very friendly.
Thanks. And thank you so much for having me. You are holding um, a very important space for a lot of people. And I'm sure that the work that you do will make, as you say, people feel less alone and make them bold enough to question where they are. So thank you for taking me on your journey.
Thank you so much. Thank you. Such kind words. Thank you. All right, everyone. Now we are at the end of the episode. Please do reach out to Aisha if you have any more questions. Follow us on our platforms on TikTok, Instagram, YouTube. Listen on your favorite podcast app or site. Remember to give this episode 5 stars. It really helps the platform. And signing us out, my name is Dr. Diane, and this is your permission to be a different kind of doctor. Bye.